Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.
Canada has tough new rules for travelers coming into the country in a bid to stop COVID-19 from crossing the border. Tonight, we'll consider whether it's the right mix of restrictions. Then, our Ontario Hubs covers why problems with phone service is a particular concern for inmates in this province. Also, we'll get a primer on cryptocurrency. And from confronting racism in the construction industry to turmoil in the stock market, we've got the Agendas Week in Review. I'm Nam Kiwanuka. It's Friday, February 12th, and that's next on the agenda. As word spread of new variants of COVID-19, calls grew for greater restrictions on travel. That's resulted in the implementation of new measures to try to catch cases of COVID coming into the country. Is it enough, too little, too late, or too much? With us to consider that, we welcome from furthest away from our studio to closest, in Burnaby, British Columbia, Kelly Lee, Canada Research Chair in Global Health Governance at Simon Fraser University and lead of the Pandemics and Borders Project. In Castleman, Ontario, just southeast of Ottawa, Dr. Paul Roumeliotis, Chair of the Council of Ontario Medical Officers of Health and the Medical Officer of Health and CEO for the Eastern Ontario Health Unit. And in Ontario's capital city, Frédéric Demanche, Director of Ryerson University's Ted Rogers School of Hospitality and Tourism Management. Hello to you all. Thank you so much for being here on the show. This is probably the latest hot topic in the age of COVID. To get into our conversation, I wanted to get from all of you one or two sentences of how you feel, how you would sum up your top concerns with the current travel restrictions that are in place, either at the federal or provincial level. Kelly, I'll start with you since you're the furthest away.
Yes, hello. Well, my main concerns with the current measures is that in terms of public health risk management, they're really a patchwork of partial measures which fall short of what we've seen that works in other countries. So the half measures announced a few weeks ago and not even implemented yet is the equivalent of locking your front door to the virus but leaving your back door open.
And Dr. Roumeliotis, I'm going to call you Dr. Paul because that's how a lot of people call you. What would you say?
I would tend to agree that we are faced with both international border travel issues, but also interregional, more close to home, and so I do believe that there could have been stronger measures put in earlier, and we are struggling at the local level for even interregional travel restrictions or concerns, particularly now with the variant in play.
Frédéric, there are concerns that we might go into a third wave. We're almost out of the second wave. What would you say are your top concerns?
Well, the top concerns, like my colleagues indicated, is the lack of consistencies in the measures that have been taken in the past months. So that's one thing. But also, we have to say a top concern is the economic viability of the travel and tourism sector, the airline sector that have been hit more than any other sector in the past few months. And that has a tremendous impact, not only economically, but also socially.
So would you say that you don't think that they should have the travel restrictions for that reason?
I'm not saying they should not have travel restrictions. I think those travel restrictions should be better applied, more consistent, and certainly sending a clear message to the travelers and to the industry so that everybody can plan properly.
It seems like in the past year, while we've tried to resume life during the age of COVID, one of the key themes has been confusion. And, if the goal is to reduce COVID cases, particularly ones involving the new variants, why just target Mexico and the Caribbean and not restrict travel to the U.S., which has been hit with COVID and where a lot of Canadians have second homes? Kelly, I'll start with you.
Yes, I think this is a great example of the inconsistency that we're already, talking about. It makes no sense to target specific destinations when the new variants are circulating globally. So really, it's about restricting all non-essential travel from everywhere and screening, quarantine, and testing everyone that comes in. That's the gold standard that other countries have followed. And what we're seeing
Countries like where?
with countries like, Vietnam, Thailand, Australia, New Zealand, I could go on. There's a dozen countries that have effectively used travel-related measures in ways that enable people that come in, we know they're safe or they will be safe, and that everyone inside the border remains safe. So that there's clear examples of that where we're not seeing that in this country.
And Frederic?
Well, I agree as well. I think those destinations were unfairly treated, especially in light of the very high traffic that continues to go between the United States and Canada, not only by air, but also by car.
Do you think, though, that if someone is going to travel, they will find a way to travel?
I think people can find a way to travel. As we know, some people are already talking about going to some of those sun destinations by going through the United States and then flying out of Buffalo, if you're near Toronto, for example. So there are different ways. But all those measures were taken to deter travel, to prevent travel. So I agree with my colleagues that it's not very consistent. I don't think it's the best way to do it, but it will have an impact nonetheless on people's intention to travel. And another impact it will have also, which I find is too bad, is that we continue to demonize the travel industry and thinking that it's one of the main reasons for the spread of the virus.
That's an interesting word to use. Are you saying that the travel industry is being unfairly targeted?
What we find, and I will be citing a study conducted by Tourism HR Canada, is that Canadians have increasingly negative perceptions of the travel sector. And even people who work in travel and tourism would not recommend to anyone else right now that they work in the sector in the future, which is concerning when we think about a future rebound of the sector. So yes, I think the travel and tourism sector has been targeted specifically, maybe unfairly. We have seen more measures, such as the travel ban, for example, instead of focusing more on testing and tracing in our own communities, which to my opinion, we have not done enough.
And Dr. Paul, I want to ask you that same question. Why just target Mexico and the Caribbean and not restrict travel to the U.S.?
I asked myself the same question when that restriction was made. This is sun destinations, and so I do believe that there's an equal risk for people traveling to the United States as it is for Mexico and others. So I would think of an international ban rather than just a targeted ban. So I didn't make sense to me, and so I agree with my colleagues as well that it should have been a more far-reaching or international type of ban, because what we're trying to do is not to try to demonize anybody. Mm-hmm. What we're trying to say is mobility equals travel equals opportunity for the virus to travel, and that's all we're saying. And this is an unprecedented time, so it's not about demonizing or trying to restrict people's rights and so on. It really is about the fact that we do know that as people become more mobile, particularly now with international travel, these viruses can travel very quickly. And so this is what our concern now, and it's even more amplified by this variant, these variants of concern.
The Prime Minister mentioned that Canada has some of the strictest restrictions on travel. Is that true?
Well, from our research, and we've compared the use of travel measures across all countries during this pandemic, Canada sits maybe somewhere in the middle. If we think about timing, countries were beginning to act as early as December 31st. And 80 countries actually imposed travel restrictions by end of February. So we went in mid-March, so we weren't the early adopters. We also often hear that we have closed borders and travel bans. In reality, the land border has been open to essential travel, of course. It's non-nationals and non-permanent residents that cannot come in for non-essential travel. Canadians are traveling for non-essential reasons. And this whole idea of essential versus non-essential is a little bit woolly. We don't have hard and fast definitions. And then we have no systematic testing of travelers coming in by land, air, and sea. It's just come in January 6th. There's some limited testing. And we have an honor system for quarantine. So compared to many other countries, Canada is certainly not among the strictest. And to be fair, we've had some stricter policies in the US and the UK, but I guess that's not really saying much.
And I guess part of this is the buy-in from Canadians, and polls show an overwhelming support for travel restrictions, Frederic. Does that surprise you?
It does not surprise me. I think, people have to be careful. They're concerned about their health and the community health. So, but again, I think that a lot of focus has been done on travel as opposed to focusing on community spread. And I found it interesting. Yesterday, some Harvard professor came out with a study to make recommendations specifically about air travel, and they propose all kinds of layered approach, basically, to mitigate the risk, but they were short of forbidding travel or recommending that travel would be suppressed. So I think there are some measures that can be taken, stronger measures that can be taken in testing, in tracing, in protecting, in behaviors, and still allow some economic activity that is related to travel. That, you have to admit it's needed for the economic ongoing activity of the country.
And correct me if I'm wrong, I think what I read, the percentage of COVID through air travel is something like 2%?
That's what has been said. Now, whether it's a reliable figure, I do not know. Now we're requesting tests, to be taken for international travel before traveling, 72 hours, PCR test. Now there is testing on arrival in Ontario. So quarantine, of course, is being used as well. So to me, those are behavioral measures that should suffice to control the virus if they are applied properly and uniformly.
And Kelly?
Yeah, the problem with that 2% figure, it's only counting a subset of total travelers, and it's a very limited system of testing and tracking travel-related infections. So we're catching largely air travelers, and only if they are symptomatic and they come forward with a test, and if they declare their travel history. So those are a lot of ifs. A lot of people get through the system. They may not be symptomatic. They may not declare. They might take a connecting flight in a domestic flight. And we're not counting anyone who's possibly exposed during the journey. So that means flight crew, taxi drivers, airport security. None of them are counted, and yet they are travel-related infections. So, if we're not counting the full number, we're not really getting the real risk measured.
Well, there have been concerns raised over the federal government's travel restrictions, particularly the measure that forces people to pay $2,000 to quarantine at a hotel. Kara Zwiebel of the Canadian Civil Liberties Association wrote a letter to the Minister of Transport and the Attorney General of Canada, which reads in part, "The quarantine rules will almost certainly impact those who travel to care for ill relatives or attend funerals, those who travel to receive specialized medical care, and those who have health conditions that will make isolating in a hotel a particularly challenging and potentially dangerous proposition. For these individuals, travel is not a luxury. As we have seen throughout this pandemic, the burden of both disease and public health regulation is not borne equally by all segments of society. Do not further disadvantage individuals whose circumstances require them to travel, particularly if they are willing and able to isolate at home." Dr. Paul, what would you say to critics who argue these measures unfairly target poor people?
First of all, my main comment is that this whole pandemic has unfairly targeted poor individuals and people who are disadvantaged in low socioeconomic status and so on. So this measure, I do recognize that it can disproportionately affect individuals who are cited in this letter. I think it's a deterrent for others to travel, obviously. I would obviously want to think that we'd be in a position, and this is a federal jurisdiction, not a provincial one, but I would like to think that people in those situations can get due exemptions from this. I would think that I would hope they'd be open to that. If, for example, that happened in my jurisdiction and I had to give an exemption in that regard, I think I would. I think out of compassion and out of understanding of the seriousness of these issues. But I think in general, it's not meant to target these individuals disproportionately, but it is meant to deter travel, obviously. And as with all public measures measures and what we've seen with the pandemic, we do have to look at this through an equity lens. So what they're saying in this letter is let's look at these regulations through the equity lens. And personally, if I were to make the decision locally, I would grant an exemption, under those unusual circumstances, ensuring that individuals, go through the proper quarantine and isolation protocols and so on.
I want to put you on the spot for a moment because I think some people will be saying, I've been at home doing all the right things. I'm not traveling. And now if I do need to do something in an emergency, I'm not allowed to do it. Do you worry that it's been a year for the pandemic, which is hard to imagine? Do you worry that we're focusing on the wrong thing, that maybe it's the messaging, so we don't need to have these rules in place if we do get the message to people to stay at home because for the good of everybody else?
Well, yes, actually, they're trying to get the message out by deterrent, obviously. And of course, my message and our message of my colleagues across Ontario and across Canada who are public health officers really is please avoid unnecessary travel. Stay at home as much as you can. As you correctly said, we're now almost a year into the pandemic. People are fatigued, but people should also understand that we are taking these public health measures during these unprecedented times. And of course, the messaging is stay home, stay safe. We've been trying to say that, and I think these are the other deterrents that are being put there by the federal government are to ensure that in case the message doesn't go through, there is some kind of a consequence. Again, my preference is education all the time, messaging all the time, but there are, and in public health, we have that fine balance between enforcement, regulation, and education. And I prefer more the educational messaging point of view, but sometimes you need these deterrents. But like I said, there is a reason for these things. Mobility of a person equals mobility of the virus. And now with the variant in play, it becomes a bigger challenge to us.
And speaking of mobility, there have been reports of snowbirds finding loopholes to avoid quarantine costs by driving back to the country. Frederic, I think you mentioned that earlier. And the government announced this week it's introducing testing at the land borders for these travelers. Is that enough, Dr. Paul?
I think it's a good step. I had read about people trying to find loopholes, and I'm really pleading to people, please do not look for loopholes. It's only a matter of time. The pandemic's going to go away. I don't understand why people look for these loopholes. But going back to that, yeah, I do think it's something that we had to address. People would fly into Buffalo and get their cars there and drive back to avoid all these things. But now I think those are stricter, and I don't understand why sometimes the government wouldn't have the same approach. You're still coming from outside of the country, where you'd have the same approach, either you land by air or by car.
And Frederic, I see you nodding.
Yeah, I agree. I mean, we're going back to what we said earlier in the show. It's all a matter of consistency. We certainly would like to see the same measures applied to everyone, and those measures have to be respectful of the reason why people travel as well. So you talk about people who are disadvantaged, people who may have good reason to travel. It's a fine definitions about what is non-essential, what is essential, but I think that could be refined. And the government could certainly help us better understand the situation.
And Dr. Paul, with parts of the province reopening this week, medical officers in different regions have been trying to discourage intra-provincial travel that's within the provinces. Can you give us some examples of how the green zones will be trying to keep people from big cities like Toronto out?
Well, the most important thing is messaging. Really, we're trying to get the message across that, whatever zone you're in and you end up in, you should stay within that zone. We try to talk about that with our colleagues. We talk about it when we discuss this with the ministry and our concerns about interregional travel. We're not in a position to impose these. I know that some of my colleagues and what I've heard is some areas where, for example, people are coming from sort of hot zones into other areas with lower incidence. Businesses are starting to ask for identification to ensure they're coming from that area. I know that other health units are putting some other orders to sort of decrease the number of people going into a restaurant, those type of things. So I know that we've discussed that with my colleagues. We're not in a position to force these interregional travels, but we're trying again can to discourage people from doing so. It is a fine balance between trying to find that right message and that right approach to be able to dissuade people from traveling from one place to another. But it is a challenge to us. But again, most of the individuals that we talk to do understand, and I hope that with our increasing messaging and the fact that now we have other factors in play, that people can understand that they should stay within their zone. And we do understand there's a discrepancy between certain areas. For example, the GTA is a hot zone, whereas other areas, as you go more east in Ontario along the 401, they're not as restrictive. And so we try as much as possible. I know that some of my colleagues are concerned about it. We message as much as we can. We're not at the point that we want to absolutely order this. It's not something that we want to do. We'd like to, again, use the approach, we'd like to reason with people and explain why we're asking for these measures.
And what
and
is
we're trying to ask for people's collaboration. Sorry.
Not to interrupt you, because I think some people, I think one of the concerns is that this might lead to a situation where there's divisiveness and an us versus them situation.
Yeah.
What message would you like to say as to the why people shouldn't be coming into those regions?
Yeah. Well, first of all, I do agree that it can cause divisiveness and anxiety among people, obviously, which is an unwanted consequences of this thing. What we're trying to explain to people is that we'd like the people not to move from one place to another, from one region to another, just because we want to collectively do an effort to be able to prevent this virus from coming back into a third wave, fearing that it might be an even worse wave, and essentially we want to save lives. Every case that increases in Ontario increases the chance of somebody being hospitalized and an elderly individual dying. And so we want to have a collective effort, and part of our collective effort, which we've been talking about, physical distancing, masking, not going to work when you're sick, and so on, and all the other public health measures includes right now, and importantly, stay home, stay safe, and don't travel unless it's absolutely necessary.
And Kelly, we touched on this a little bit earlier, but do you think that the measures that other places like Australia have used to curb domestic travel, do you think that that would work in Canada?
There are some measures that will work. I know a lot of people say that, Canada is not Australia, it's not a big island. I would compare Canada more to Thailand and Vietnam, which has land, air, and sea arrivals. And they've done very well with actually fewer resources. So there's a lot of use of hotels for quarantining, for example. It may or may not be paid by the traveler. There's a lot more screening and testing being done at all borders. And this is doable, but you have to act early. And I think that's what our research is showing, is that we need to act earlier
So are we
in
too
order
late?
to get on top of it. We are probably for the first wave, for sure. But these new variants, I still think we're not too late. These new variants are like a new pandemic in many ways. We know that they are brought in by travel. They didn't swim here by themselves. So these new variants are, circulating in the U.S. in particular. And, we have 33 states now announcing cases, including Florida, which has the largest number of cases. So there's a window of opportunity for Canada to be more vigilant, to ensure that all travelers that come in are either not carrying the virus or are quarantining. And we're still not doing that. And I think if we followed the other countries' examples, we could really prevent a lot of hardship later on.
Well, not everyone is convinced that travel bans are the way to go. American virologist Angela Rasmussen is with the Georgetown Center for Global Health Science and Security, which is in Washington, D.C. Here's what she had to say in The Guardian on December 23rd. She writes, "Rather than harsh and largely ineffective travel bans, we should instead focus on encouraging compliance with proven interventions such as masking, distancing, avoiding crowds and enclosed spaces, avoiding gathering outside of one's household or quarantine pod, and practicing good hand hygiene. By emphasizing the additive nature of risk reduction, transmission can be reduced in a way that empowers people with the information to make good decisions to protect themselves and their families." Frederic, I'd like to start with you, but I want to ask all of you this question. What would you say to those like this virologist who believes, quote, imposing onerous travel restrictions alone is unlikely to make a significant impact in the overall pandemic? Frederic?
Well, first of all, I think the airlines, the travel sector has done tremendous efforts to protect passengers and to protect employees. They have been the first one to implement safe practice, PPEs and all kinds of different elements, to processes, to protect travelers. And I think indeed that banning travel is the wrong message to send. I think we can still travel. We should, however, be paying more attention to our own behaviors, and that is what is really important. So the main barriers are going to be physical distancing, masking, cleaning, washing, testing, tracing. Those are the distances that I think will make a difference. So I do agree with Professor Rasmussen, and it goes in the sense of the Harvard study that was released yesterday about implementing all kind of risk mitigating measures without banning travel.
And Kelly?
Yeah, and I think, nobody's calling for a ban on travel, and sometimes travel restrictions are not appropriate. And you have, for example, a lot of virus circulating in your jurisdiction. And if you implement strict travel measures, you might actually be, putting your limited resources in the wrong place. So I agree, and it has to be a joined up strategy. But the way I look at it is, you can draw an analogy with battle strategy. So where do you want to draw the line of battle? If it's at the national border, then that's, if you're in a situation where you have low infections and out there are a lot of infections, the battle line could be your national border. But if you don't draw the line there, it gets downloaded to the provincial level in our case. And if the provinces don't do anything, it becomes a community problem. And it's quite unfair to expect, everyday Canadians to battle these new variants through hand washing and masks. That we know these new variants are very transmissible and that you can do the normal things, and there's evidence to show actually that's not enough. So it's, where does the responsibility lie? Where are we going to draw these battle lines? And, it all comes down to good surveillance data and about understanding how these new variants are behaving. And they are looking like they're behaving quite differently, and we need a different strategy, which should include travel restrictions, but that's not all we do. So it's a package of measures we need.
And Dr. Paul?
It's as if I wrote that letter, actually. I would say the same thing, except that I would layer it. When we talk about, the multiple layers of protection, for example, in schools, we have multiple layers of protection. And so in the community and at large, so you start, as Kelly said, community, province, and then nationally, we have those multiple layers. And I think restrictions and travel restrictions or control or deterrence are part of it. But again, it goes down to, as you bring it into closer to your hometown, it goes down to really those measures that the virologist talked about, which are really masking, distancing, washing our hands, and so on. So it's the layered approach. So it's not just one, it's all of these together working synchronously and collectively to be able to achieve the goal, which is really to decrease the burden and transmission of the coronavirus, the COVID-19, and in particular right now with the new variants.
In our last minute, I'd like to ask the last question to Kelly. What measures do you think need to be in place to more effectively curb the spread of COVID and the new variants?
So overall, I think we're back to where we started. We need a coherent strategy, and that needs coordination across the federal and provincial governments and probably at the local level as well. We know that travel and COVID are intimately connected. So we need to move now on these new variants because they'll scupper a lot of the work that we've already done. So I would start by clarifying very clearly what essential and non-essential travel is. We need to get non-essential down to hopefully zero or very near to zero. So that reduces the burden on border management. And then we, up the screening, testing, and quarantine of essential travel or any travel that's left over. If people cannot quarantine, such as truck drivers, flight crews, they need to be vaccinated with priority because they can only do their jobs by moving around. And the rest of us, we do continue to do what we do. We need better data, and we need to use that data to manage this new risk. So overall, again, we need this coherent strategy, and that's not what we're seeing at the moment.
Well, I want to thank all of you for taking the time to speak to us tonight. We really appreciate your insights and wishing you a very happy Family Day weekend. I hope you get some rest. Thank you.
Thank you very much.
For inmates across this province, the telephone is still the main means of communication with family, lawyers, and anyone else beyond the prison walls. But it is far from straightforward to make a call. And as our Eastern Ontario Hub journalist Marsha McLeod recently found out, progress improving the phone system is a work in progress. She joins us now from Kingston to explain. Welcome to the show.
Thanks for having me.
Now, you looked at phone systems in the Ontario prison system, but it was kind of an interesting way in how you kind of got to this story. Tell us about that process.
Yeah, so for most of 2020, actually, I was reporting for the Globe and Mail reporting on the Ontario's correctional system for the Globe and Mail. And I had one really striking call where I picked it up and the person who's incarcerated in a facility said to me, "Hey, Marsha, could I ask you a favor?" And I said, it really depends on what the favor is. And he said to me, "Could you look up the phone number for H&R Block?" And I was kind of struck by that, just realizing he said to me, I had a banking issue, I need to call the bank, how difficult it is to get information, not just necessarily for contacting your family, but a whole range of services that you might need to get in touch with.
Very interesting. Now, I'm sure some of our viewers would be surprised to hear that for inmates here in Ontario, it's not straightforward to get access to a phone call. There are some issues and challenges and obstacles with that. Can you explain kind of how the system works?
Yeah, so imagine a payphone, just like that you'd see on the street, and that's what inmates generally have access to on the block. But when you pick it up, they're able to make collect calls. And I know, for some people, a collect call kind of seems like a relic from the past. I don't know where else collect calls are really used. And part of that means that the person who picks up on the other end is the person who pays the charges. But the really significant thing is that inmates are only allowed to call to landlines, so they can't call cell phones. And again, I don't know how many people who have a landline. I don't know a ton in 2021. And then the last thing I'll mention is that calls are capped at 20 minutes. So for instance, if you need to call your bank, but there's a 15-minute hold, then you'd only have 5 minutes left to actually deal with the matter at hand.
This seems like an obvious question, but I'm assuming inmates also can't receive phone calls, correct?
Yeah, no, it's a good question because I think that's something that people could be confused about. No, inmates cannot receive phone calls. They can only place outgoing calls. So if a family member is trying to get some information to an inmate, really their option is just to sort of sit around and wait for that next call. And I mean, maybe another thing that sounds obvious, but maybe isn't, is that of course there's no internet in a jail. Mm-hmm. So looking up a phone number can be pretty difficult.
Mm-hmm. Now, we have a couple of photos. Can you tell us what we're looking at here? Can we have the first photo up? There we go.
Mm-hmm. So this is Toronto South Detention Centre. This is pretty typical of how the phones would be laid out, very much in a public space. If an inmate is making a phone call, pretty much anyone on their block can listen in to what they're saying.
And then the next photo here, what are we looking at?
This is actually Ottawa Carleton Detention Centre, a minimum security range. And you can see at the back, there's a phone. Again, very similar. Everyone in the block can listen in on your call. And that's the place where inmates would have to make any call from and do any business that they need to do.
Now, Marsha, you kind of talked about, these are payphones. They look like payphones, but I'm imagining, I'm not putting in a quarter to put it in there. But the question I'm asking is, who's footing the bill here?
Yeah, it's a good question because it's a collect call based system. It's the person who picks up who pays. So for a law firm, when inmates call them, they just foot that bill. But for families who are receiving calls from loved ones, it can get really, really high and be a pretty big impact on their lives. I've heard that charges in the range of a couple $100 a month are very common. These charges can get really, really prohibitive for families.
Now, I understand in your article for TVO.org, you talk about how the government has helped inmates during COVID-19. Tell us about that.
Yeah, and so one thing that the government has done is that they have instated a $20 a month calling card. And so to kind of help offset the fact that with COVID, visits have been shut down sort of in the beginning of the pandemic. But and on this calling card, actually, it's interesting because what I've heard is that inmates can call to cell phones because it sort of subverts this collect call system. But the problem is it can't be topped up and $20 goes very quickly.
I want to talk about who owns these telephone contracts at Ontario prisons. I understand there's a change of ownership from Bell to a company called Synergy. What do we know about that?
Yeah. So when Bell held this contract, they came under a fair bit of criticism, partially because some people found it quite hypocritical that they have this rather well publicized Bell Let's Talk Day, but it's difficult to talk from a prison if you cannot afford the costs. So Synergy has taken over, and Synergy is based in San Antonio, Texas. And actually, I was really curious to know how many contracts Synergy had in Canada. And so I reached out to every provincial and territorial correctional system in the country. And I found that of 10 that replied to me, 8 of them contracted with Synergy, which I actually found that kind of surprising that their market share was so high.
Now, one of the things that we've learned in this pandemic with COVID is, that need to be connected to people, whether that's through the phone or through Zoom calls and stuff. But the same is said for inmates as well. What have you learned from the conversations that you had about the importance of inmates being needing to connect to family members, lawyers, and to their banks?
Yeah. So one thing I'll just say right off the bat is that in Ontario's correctional system, about 70% of people incarcerated in it, give or take, are pre-trial. So they're waiting to be sentenced, they're waiting for the trial, they're trying to sort out bail. And the reason I mention that is that Ontario is extremely reliant on what are known as sureties. Sureties are basically a person who says, yep, when that person gets out of custody, I'll watch over them, I'll be responsible for them. But to arrange a surety often involves a lot of coordination between families and inmate, often lawyers. And so not being able to connect actually can have really serious impacts for whether somebody can get their bail arranged. But second, I'll just say, when someone's in custody, life goes on. As we mentioned, there are bills. I've spoken to parents who are in custody and all they want is to be able to stay connected with their kids, I think is another big thing that I've heard.
Now, I am curious to know, with this province, how do we stack up with the rest of the provinces here in Canada and globally?
Yeah, well, Ontario actually, of the ministries that I surveyed, all of them said actually that inmates already have the ability to call to cell phones. So Ontario certainly is an anomaly there, but also just outside of Canada, in the US, it's really not an ideal system because most of the time inmates' families are required to pay for this. But in a lot of state correctional systems, inmates do have access to a form of email. And additionally, I learned that in the UK, access to email in prisons is pretty standard.
And very quickly, I do want to ask you about, any solutions. You spoke to some advocates. Do we see any progress in this?
Yeah, first I'll just quickly say is that the ministry has said that they are going to get a system in place that allows calling to cell phones for the second half of 2021. Advocates say that's really not good enough. I've spoken to folks at the Jail Accountability and Information Line in Ottawa, which helps inmates connect to services and their families. And they said, what we really want is free calling and an elimination of those 20-minute caps.
Marsha, I want to thank you so much. Another very important story for the province. That's Marsha McLeod, our Eastern Ontario Hub journalist. And now something I've been working on. Cryptocurrencies like Bitcoin have been making headlines over the past few months. But do we know how they work? Here is a crash course explainer in Bitcoin and cryptocurrency. Whether or not you follow the stock market closely, you have probably heard about the recent surge and fall of cryptocurrency. Earlier this year, one Bitcoin's value topped $40,000 US for the first time ever. But a mere 2 weeks later, Bitcoin slipped by more than 20%. Soon there were stories of Bitcoin users who lost their passwords to their digital wallets, losing out on potentially millions of dollars. And here in Ontario, one court has been mulling over the idea of whether shares in Bitcoin should be considered in a divorce settlement. That volatility has brought up a lot of questions. How does Bitcoin work? Is it too late to get into the market? And for a lot of people, what in the heck is cryptocurrency? In 2009, Bitcoin, the first cryptocurrency, was born. Bitcoin is digital, meaning there's no physical coin you can touch or hold. But it is different from the digital money you spend shopping online. Bitcoin is what is known as a decentralized digital currency. That means there are no banks, government, or other intermediaries overseeing these transactions.
If you go to your bank and you see the balance on your accounts, that's basically like a bank ledger. The bank knows how much money each person holds in their accounts. The problem with this is that you trust the bank to be accurate, to maintain this, and to be accountable. When you have something like a blockchain, Now that trust is redistributed between multiple parties.
Bitcoin and other cryptocurrencies run on blockchain technology. Think of blockchain as a database. Information is stored in blocks. This includes things like transfers and purchases. Once a block is full, it is linked to the previous block, creating a chain. All the blocks are connected chronologically, creating a chain that started in 2009 and continues to this day.
Most of the time, it's completely auditable. It's fully open and transparent like Bitcoin. You can see the ledger. As long as you have an internet connection, you can download that distributed database, and you can see every single thing that has happened on Bitcoin since day one.
So why does Bitcoin have value? The simple answer is people give it that value. They trust it. Currency can take many forms, but the properties of what is known as sound money are universal. Divisibility, durability, recognizability, portability, and scarcity. When we talk about the divisibility of fiat currency like Canadian dollars, we know that $1 can be broken into 100 cents. In comparison, a Satoshi is the smallest unit of a Bitcoin, equivalent to 100 millionth of a Bitcoin. Unlike Canadian dollars, which are printed through the Bank of Canada, there is a limit on how many Bitcoins are available in the market. Only 21 million Bitcoins will ever be produced. Now, there are two popular ways of acquiring Bitcoin. You can purchase them online or at one of the 11,000 Bitcoin ATMs across Canada. Or you can do what is known as mining. No, you won't be needing a helmet and chisel for this type of excavating, but rather a powerful computer.
Mining was designed as an incentive for people to upkeep the Bitcoin network.
The concept of mining isn't all that different from mining gold. As you help process transactions on the blockchain, you are rewarded with coins. Back in 2009, a miner was rewarded 50 Bitcoins for every block they produce. However, Bitcoin goes through what is known as a halving cycle. In other words, the amount of Bitcoin released into the world is cut in half every 4 years. This cut in supply can help explain the volatility of Bitcoin's value in the first months of 2021. Today, a miner is rewarded only 6.25 coins for every block they process.
So when you think about it like that, Bitcoin actually goes through a pretty interesting cycle in the market where every 4 years, that supply gets cut in half, and it obviously messes with the economics of it because now it becomes much more scarce.
One of the biggest advantages of cryptocurrencies like Bitcoin is that you can send large sums of money halfway across the world in a matter of 10 minutes. But what can you buy with it? While still limited, you can buy fast food, a hot cup of coffee, plane tickets to your next vacation, tickets to concerts and sporting events. More recently, Tesla announced it would start accepting Bitcoin as a payment method for its products after buying $1.5 billion US in Bitcoin. Bitcoin was created by Satoshi Nakamoto. The name is a pseudonym, and Bitcoin's partial anonymity is both an appeal and a concern.
All kinds of information is captured on there, the date and time that the transaction occurred, whose address it was sent by, and to whose the address it was received. But there's only one piece of important information that's not held within there, and that who is the holder of the account.
As cryptocurrencies have become more popular, so have the scams related to them.
What they're asking for is for Bitcoin in lieu. And so one of the most popular ones that we're seeing here in Canada is the CRA scam, where a fraudster will contact somebody, usually via the telephone, and they'll basically scare them into sending payment to them unless or else suffer, time in jail.
According to Chainalysis, criminal activity accounted for only 2.1% of all cryptocurrency transactions. However, that figure accounts for a whopping $21 billion US in transfers. While Bitcoin is the most popular of cryptocurrencies, there are over 8,000 different cryptocurrencies out there today.
Just make sure that you do your research and that you develop an understanding of what cryptocurrency is, the methods of acquiring it, and who those players are. Make sure that you're dealing with somebody who's reputable.
Although Bitcoin was originally conceived as something that would become a convenient currency, its role has evolved.
It is sort of changed over time to become more of a store of value and hedging against stuff like inflation.
This technology is not going anywhere. We expect it to be around forever. I mean, it's actually kind of exciting to be a part of it and see it grow over time.
It just becomes a good form of digital gold at the end of the day, more so than it is actually a day-to-day transaction currency.
The agenda this week looked into the recent social media prompted turmoil in the stock market and examined the problem of discrimination in the province's construction industry. Have a look.
Let's, Navneet, go on, because I want to ask you about something that you had in the Star just recently. You wrote in your story how the aggregating power of social media allows a very small number of people to distort and disrupt. Amplify on that for us, if you would.
Yeah, I think the Reddit is a good example of the ambivalence of social media and the internet. Like, so on the one hand, the aggregating power of the internet, what it allows people to do is gather around a topic, find like-minded people, and form a kind of a collective or a mass of people that together has far more power than people would have individually or would have had prior to social media. I think that the ambivalence to that comes in where, that can be quite positive in the sense of, that we've seen movements like Me Too, like Black Lives Matter kind of coalesce online and gain more momentum and gain more power through that aggregating power. But we've also seen, targeted harassment campaigns. We have seen election interference. We have seen misinformation and the rise of conspiracy theories that also arise through that aggregating power. And so I think that's where my kind of skepticism comes from, is that if we sort of uncritically celebrate that aggregating power, we may also be welcoming movements or trends in society that we would actually like to sort of tap down on.
Yeah, Brian, one of the things you also hear is, on these chat sites, you will hear people say, all I need is to have Elon Musk say one nice thing about this stock and it's going to go through the roof. And in fact, that's kind of what happened with GameStop, right? Elon Musk had something positive to say about GameStop, and it went right up into outer space. Do celebrities, as a general rule, are they able to play this kind of outsized role in the movement of stocks?
Well, there's no question that influencers are having a role in driving some of these things. There is an interesting sidelight to the Elon Musk thing. As soon as Elon Musk issued that tweet, basically telling people to jump aboard, one of the big funds that had been long in GameStop and had bought the shares at only $10 a share, sold almost immediately as soon as Elon Musk opened his mouth. And they're now known as the company that uses Elon Musk as a sell point. If Musk tells you to buy it, get the heck out. And they made about $600 million profit. But Elon Musk is not the only influencer who was involved in these things. There were 3 or 4 major players who said, yes, let's get on this thing. Elon Musk hates short sellers. He despises them. And as soon as he saw that this was creating a terrific short squeeze and screwing some of those big hedge funds, he said, great, let's do it, because he'd like to wipe out short selling completely if he could.
April, what do you think of this phenomenon of celebrities either touting or talking down stocks and having outsized influence given their knowledge of the markets?
Well, I think that, social media's effect on the stock market, it's definitely come to light in a really big way in recent weeks. But as a business journalist, it's been interesting because it's not just these celebrity investors, these few celebrity investors in the last couple of weeks. I think we've been watching and waiting for Trump to tweet and looking at how he affects the stock market or affected the stock market before. And so that isn't really new, but it's definitely new in the sense that these were really big moves. The other thing I would say is I would just go back to the old investing advice of, trying to differentiate between market noise and, signal the financial health of companies, right? You, as an investor, that's one of your responsibilities is to differentiate between what information you trade on and what is just noise.
We'll look into equity, building equity for Black people within the industry to ensure that people like myself can see Black leaders within construction sites, within the offices, and that builds that level of respect, that level of equitable representation that people feel they can do those kind of things to people of my color and people like myself. Also, we are to up our mental health access, mental health awareness access, and also we also have to ensure that we don't sit comfortable in our reporting system. We have to ensure we create some upgrades to our reporting system so that people have a voice. People can encourage to bring into the forefront people that are engaging in these actions. So just to keep the long story short, the fact is, as Rosemary said, allyship, people coming together, really encourage people like myself to say, we got to step up, we got to stand together, and we got to help propel this change. And really seeing intentional actions help to propel our trust again, because trust was broken, and I felt that broken trust. But seeing people coming together help to make that happen again for someone like myself.
Okay, Sefton, let's hear from you on this. And in answering the question, maybe you can tell us during the course of your career how much racism you yourself have experienced on the job.
Wow. You know what? I want to thank Rosemary and Samuel for their answers. It's really strengthening to hear those words, and to also not only hearing the words, but I've heard and I've seen the responses that has been put forward by them. Now, the experience in the workforce, I have many times received and jobs from different organizations, different companies, where we've come in to build a complete a structure. And after being on the phone, going through the emails, sending in the tenders, receiving the welcome packages, now going out to meet who's in charge, and you sit there and you wait in the office, and the person comes out once and they look around. They come out twice, they look around. Then they come out the third time. This is half an hour after our bid there. And they said, has Mr. Spence shown up yet? Well, the situation is Mr. Spence has been here for about 40 minutes, and I'm Spence. And on the way back to the office where you hand over your package with all your certificates and everything like that, now you sit down in the office and he tells you that the job is no longer available. This is after when you've done all the procurement, you've done everything already to secure the job, and even transfer of information, security codes, different things like that. That has happened. And it's happened more than once in my experience. Many times because I don't have maybe a strong accent when it's necessary. They mistakenly and think, oh, you were of a different, culture. So, but when I go out on site and they look at me, then they go, oh, okay, this doesn't work. So it's happened many times. I've had also recently with my own son in Vancouver, finding a noose right beside himself, put there by another worker. It touches home. It changes your look. It changes your thoughts. It makes you think, what did you do wrong? Where did I go wrong?
Sefton, let me jump in here. Do you think it's possible the people who do these things with the nooses don't appreciate the significance or the gravity of that action?
Ignorance goes a long way. And I think, yes, there is a gravity that they don't understand because they haven't gone through the process. They haven't gone through the lifestyle. Now, I can't say that I have also gone through it as such, but my son out in Vancouver first, they targeted his car and they wrote nigger on the side of his car. I'm going to put it out there frankly. But the community rallied around him. And even the dealership where he went to get his car looked at to be refixed, they took it and they redid his whole entire car just because of what somebody else in their ignorance had done. Now, within the community, and there's that fear within the construction workers because they're not too sure what the next step is. So that's why agencies like TCCBN and Samuel over there at Ellis Don are really necessary. And here at ACA, it's really necessary that we as a whole strengthen the community, bring them together with knowledge and understanding, and put them together so that they could stand up again, because this thing beats them down and they're not too sure on what is it that they need to do in going forward.
That's just some of what we covered this week on The Agenda. For more, including the full conversations, you can visit our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda. And that's it for this Friday, February 12th, 2021. Next week, we'll find out why the history of Black pioneers in Ontario's early years isn't better known, assess the merits of COVID-19 vaccine diplomacy, and bring you the third installment of the TVO Toronto Star Joint Initiative, the Democracy Agenda. I'm Nam Kiwanuka. Thank you for watching TVO and for joining us online at tvo.org. Have a wonderful Family Day long weekend, and Steve will see you on Monday.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. Ontario Hubs are made possible by the Barry and Laurie Green Family Charitable Trust and Goldie Feldman. And by viewers like you. Thank you.